Today I would like to show you several aspects on which UNICEF is focused in Europe and Eastern Europe and Central Asia, and also in Moldova. I will introduce several models supported by UNICEF and the future perspectives. So, prevalence and the incidence of HIV, unfortunately, in the region of Eastern Europe and Central Asia is increasing. Unfortunately, these data show that more than 160,000 people in the last decade have been diagnosed with HIV. The largest share, some 20% of this increase, refer to the last decade. We are also concerned by the fact that the number of deaths increased as well by 34%. The teenagers from the Eastern Europe and Central Asia region, they are among the most vulnerable populations in relation to HIV infection. This region has recorded a significant growth, especially among young people, and the HIV incidence to 1,000 to 1,000 people of this age were 4 times higher than among children. This is according to the data from 2023. The key factors, key risk factors for teenagers: consumption of injectable drugs. An important factor of the new cases of HIV, especially among youth, is the drug consumption, drug use, and especially injectable drug use. It is estimated that there are some 3.2 million consumers of or users of injectable drugs in the region, and 50% of them are less than 20 years old. When we speak about injectable drugs, in case of youth, we refer not only to injectable drugs, but also to other psychoactive substances that develop addictive behavior, which leads to dependence of injectable drugs later on. Sexual transmission, it's another factor. Although initially HIV transmission has been determined by the drug consumption, the heterosexual transmission becomes more and more significant. Practically, as of now, in the Eastern Europe and Central Asia, the heterosexual transmission is predominant. Unsafe sexual practices, another factor, including the decreased use of condoms, multiple partners. This contributes to the increase of infection rates among adolescents. Especially the young women are more affected, among which the infection rates increase. And you could see in the previous presentation by Dr. Lishko how the number of new cases increases among women and how much more this number is among women. Another factor is social and economic challenges. Unfortunately, the fast social changes, economic difficulties, armed conflicts, including in Ukraine, and increased unemployment rates, they affect disproportionately the youth. And these factors, they increase the vulnerability to both drug use and risky behavior. Not to talk about the inequitable access to basic services. And here we mean prevention services, access to condoms, counseling services, psychosocial support services, stigmatization and discrimination. Unfortunately, as another risk factor, unfortunately, many studies have shown today that the level of stigma and discrimination is quite high. And when these structural barriers, they are at the system level, when 52% of the medical workers have the preconception or some preconceptions about the risk, the false risk to get infected with HIV in the moment of interacting with a patient living with HIV, then we understand that this problem remains a very topical one. And actually, it determines the young people not to go to get these basic services, not to access the basic services as health and prevention and support services. So, regarding the risky behaviors, just a minute. High-risk behaviors. We have talked about the drug use, but there are some other risky behaviors as well, as we were mentioning sexual work, substance use, and we mean not injectable substance, but psychoactive substance use. And these practices, they increase a lot the vulnerability to HIV. For example, we know that among the key population, the level, and we do have data about this, among the sexual workers, for example, especially of age from 20 to 24 years, the HIV level is 64%. Practices for HIV prevention. One of those practices that in which UNICEF has invested a lot in Eastern Europe and Central Asia is the development of youth-friendly services. You have had a broad presentation before, and you saw the package of services rendered by these like youth-friendly clinic. Practically, these services, they cover both full offering of a service package relating to many youth behavior that might lead to risky behaviors and HIV infection, and at the same time they lead to the development of expanded packages for vulnerable groups and groups with a higher risk of infection. And here we mean the PrEP package and the PEP package and the outreach services in the field. Within the youth-friendly health services, we have had several interventions, especially in those communities where the HIV prevalence was quite high. Especially, I mean here, those activities that have been done in belts city, and there we have learned a lot how important it is to gain the trust of the youth so that they come to us and ask or receive the prevention and healthcare services. At the same time, for the purpose of reaching the vulnerable groups, and here we mean not only the high-risk groups, but also the socially vulnerable groups. And we know that the rural population in the Republic of Moldova has quite a decreased access, even geographically, to many healthcare services, especially to the youth-friendly services. And the development of a mobile team brings these services actually to the rural communities and to that environment where no such services have been rendered before. And by gaining the trust and understanding, by making the young people understand that these services are rendered systematically and that they are confidential, they are anonymous, we give the youth access to the early testing services, information services, education counseling services, and medical services as well. Educational and awareness raising campaigns. Of course, it's critical to have education in HIV prevention. And of course, UNICEF has promoted many programs, including in school, offering adequate information about HIV. Various curricula have been developed, but unfortunately, the curriculum about the healthy lifestyle is such a discipline which is a facultative one, so it's not mandatory to have this discipline in the curriculum, in the study plan. According to the analysis from 2018, only a certain portion of school have accessed this curriculum. And we know, and we do have evidence that these initiatives, they improve the knowledge about the safe practices, and at the same time they reduce stigma and discrimination among the general population. peer-to-peer educational programs. They are actually not so much educational programs, but they mean the creation of volunteering teams within the youth-friendly services, but build this peer-to-peer relation with the youth from the community and bring them in and build and participate in building this trust in those services that are being provided to the youth. Another practice is represented by the local mobilization activities. In case of those activities of local mobilization, actually they are managed according to the local aspects. For example, in some communities, we have the Roma community, predominant Roma community, that have a certain behavior. In other communities, I mean, the HIV prevalence is quite high. And of course, the practices are closer to the truth that is in that reality. Activities of community mobilization, they include the collaboration with families, with schools, with other NGOs to promote an open communication environment for HIV prevention. Other practices, like for example, partnerships with local organizations. UNICEF traditionally collaborates a lot with the governmental institutions. And here we mean the government line ministries like Ministry of Education, Ministry of Health, Ministry of Labor and Social Protection. And practically, UNICEF has facilitated the implementation of targeted interventions for the high-risk groups like those young people that inject drugs or those who do sexual work. Actually, these programs are quite varied from the cultural point of view, and through the NGOs, they are specifically addressed to the corresponding groups of population. Advocacy for policy amendment. This is actually that topic with which we face a lot of challenges, and a lot of work is necessary to be done here. A study done by UNICEF in the Eastern Europe region and Central Asia has found that there are age-related barriers related to the age of a teenager when he could access or she could access the service. There are many interventions that require mandatorily the confirmation or consent of an adult, of a caregiver, which might be a parent or legal representative. And this refers to several interventions like HIV testing, testing for sexually transmissible infections, consultation, medical consultations by a doctor. These barriers, they are quite strong because they are systemic, and the system stops the access to services. And currently, this advocacy work continues at the governmental level to review this provision from our legislation and to adjust the provision to the level of awareness and capacity development of the child. When the child has the capacity to take a decision in their supreme interest. And the last point I wanted to mention, practices, HIV intervention practices. These are support for mental health and psychosocial support. Together with the youth-friendly clinics and Vita Research Center, we have supported the creation of a hotline for the teenagers. Actually, this hotline was created in response to the COVID pandemic because the young people could not come and get the service physically, and we thought that it would be very good to have an alternative. And finally, it turned to be a service which is very, very required even now, especially during the refugee crisis, when quite a large number of young people called that hotline not only to get this service, but also to get support and counseling, including psychological counseling. 20% of all the calls refer to the psychologist for counseling, actually. And on the last slide, I have shown several photos from our joint activities together with our partners, especially, those activities in the north of the country. Thank you.